In this podcast episode, Dr. Ann Mckee, a leading neurologist and researcher in the field of chronic traumatic encephalopathy, or CTE in short, shares her groundbreaking findings on the devastating effects of head trauma in contact sports. The podcast delves into various aspects of CTE, its implications for athletes, and the broader societal impact of these injuries. Dr. Mckee begins by outlining the alarming prevalence of CTE among young athletes, particularly those involved in contact sports like American football, boxing, and soccer. In a study of 152 young athletes, a significant number exhibited signs of brain damage due to repetitive head impacts. This revelation is shocking, especially considering that many medical professionals have historically downplayed the seriousness of these injuries. Dr. Mckee emphasizes that CTE is not just a concern for professional athletes, it affects young players who may not even realize the risks they are taking. The long-term consequences of these injuries can be life-altering, leading to severe mental health issues, personality changes, and even suicide. The discussion highlights the need for greater awareness and understanding of CTE, particularly among parents, coaches, and young athletes themselves. Dr. Mckee's research has shown that CTE can manifest in various ways, including depression, aggression, and cognitive decline. The tragic stories of young athletes like Wyatt Bramwell, who took his own life after struggling with the effects of CTE, serve as poignant reminders of the urgent need for change in how we approach contact sports. Dr. Mckee explains the scientific basis of CTE, describing it as a neurodegenerative disease caused by repeated head trauma. The injuries occur not only from concussions, but also from subconcussive hits, those that do not result in immediate symptoms, but still cause significant damage over time. The brain's structure is fragile, and the acceleration and deceleration forces from impacts can stretch and twist the brain, leading to the formation of tau protein deposits. These deposits disrupt normal brain function and can lead to severe cognitive and emotional issues. The discussion also touches on the specific areas of the brain that are most affected by CTE. Dr. Mckee notes that the disease often begins in the frontal lobes, which are crucial for decision-making, impulse control, and emotional regulation. As the disease progresses, it spreads to other areas of the brain, ultimately leading to dementia. This progression underscores the importance of early detection and intervention, as well as the need for ongoing research into the mechanisms of CTE. One of the most distressing aspects of Dr. Mckee's research is the impact of CTE on young athletes. Many of the individuals studied exhibited early signs of the disease, raising concerns about the long-term effects of playing contact sports at a young age. Dr. Mckee emphasizes that the symptoms of CTE can manifest much earlier than previously thought, with some young athletes experiencing significant cognitive and emotional challenges in their late teens or early 20s. The podcast highlights the case of Aaron Hernandez, a former NFL player who was diagnosed with severe CTE at the time of his death. Dr. Mckee's examination of Hernandez's brain revealed extensive damage, raising questions about the role of CTE in his violent behavior and eventual suicide. This case, along with others, illustrates the urgent need for parents and coaches to understand the risks associated with contact sports and to prioritize the health and safety of young athletes. Despite the growing body of evidence linking CTE to contact sports, Dr. Mckee expresses frustration at the reluctance of some medical professionals to take these findings seriously. Many continue to dismiss the potential consequences of head trauma, often attributing behavioral changes to other factors. This disconnect between research and clinical practice can leave young athletes and their families without the support and resources they need to address these issues. Dr. Mckee advocates for increased education and awareness among medical professionals, urging them to recognize the signs of CTE and to take the concerns of athletes and their families seriously. By fostering a more informed and proactive approach to head injuries, the medical community can play a crucial role in preventing the long-term consequences of CTE. The podcast also addresses the NFL's response to the growing awareness of CTE and its implications for players. Dr. Mckee recounts her experiences presenting her findings to NFL officials, noting that her research was initially met with skepticism and denial. However, As more evidence emerged, the NFL was forced to confront the reality of CTE and its impact on players. In 2013, the NFL reached a $765 million settlement with former players and their families affected by concussion-related injuries. While this was a significant step forward, Dr. McKee points out that the settlement did not adequately address the long-term implications of CTE for players diagnosed after 2015. This ongoing issue highlights the need for continued advocacy and reform within the league to protect current and future players. Dr. McKee emphasizes the critical role of brain donation in advancing our understanding of CTE and other neurodegenerative diseases. The only way to definitively diagnose CTE is through an autopsy, making brain donation essential for research. She encourages families to consider donating the brains of loved ones who have suffered from head trauma, as this can provide invaluable insights into the disease and help inform future prevention efforts. The podcast features poignant stories of families who have chosen to donate their loved ones' brains for research, highlighting the legacy of knowledge that can be left behind. Dr. McKee's work relies heavily on these donations, and she expresses gratitude for the families who have made this choice in the hope of preventing similar tragedies in the future. Throughout the discussion, Dr. McKee advocates for significant changes in how contact sports are played and managed. She argues that while sports are essential for the psychosocial development of children, the risks associated with head trauma must be acknowledged and addressed. This includes implementing measures to reduce head impacts, such as limiting full contact practices and educating coaches and players about the risks of head injuries. Dr. McKee believes that it is possible to maintain the benefits of team sports while prioritizing player safety. By fostering a culture of awareness and responsibility, sports organizations can help protect young athletes from the long-term consequences of head trauma. Parents and coaches play a crucial role in shaping the experiences of young athletes. Dr. McKee urges parents to educate themselves about the risks associated with contact sports and to advocate for their children's safety. This includes having open conversations with coaches about injury prevention and ensuring that proper protocols are in place to address head injuries. Coaches, too, have a responsibility to prioritize player safety. Dr. McKee emphasizes the importance of training coaches to recognize the signs of head injuries and to implement strategies to minimize risks during practices and games. By working together, parents and coaches can create a safer environment for young athletes. The discussion also touches on the broader societal implications of CTE and head trauma in sports. Dr. McKee highlights the need for increased awareness and advocacy at all levels, from grassroots organizations to professional leagues. As more people become aware of the risks associated with contact sports, there is potential for significant change in how these sports are played and perceived. Dr. McKee's work has already begun to shift the conversation around head trauma, but she acknowledges that there is still much work to be done. By continuing to raise awareness and advocate for change, she hopes to inspire a cultural shift that prioritizes the health and safety of athletes. Looking ahead, Dr. McKee emphasizes the importance of ongoing research into CTE and its implications. She believes that understanding the mechanisms of the disease is crucial for developing effective prevention strategies and treatments. This includes exploring the role of inflammation and vascular health in the progression of CTE, as well as identifying potential interventions that could mitigate its effects. Dr. McKee's commitment to advancing our understanding of CTE is unwavering, and she encourages others in the field to join her in this important work. By collaborating and sharing knowledge, researchers can continue to make strides in understanding and addressing the impact of head trauma in sports.